Welcome to our 6th Annual Health Symposium. I got a great program for you today, and like our previous meetings, you will be leaving here with some valuable takeaways that you can implement into your organization. We partnered with Crosslinks to put these health symposiums on, and Roy Pullman and his team always put a great program together. And I'd like to introduce you to Roy, who is with Crosslinks and is responsible for today's program. Thank you.
It's a delight to be back in Vancouver, and as Greg said, this is our 6th event partnering with TRG, and it's a delight to be working with an organization like TRG. And if you're an employer in the room, I'm sure that you benefit from the fact that the quality advice and organization that you work with and having them represent your health and dental and your benefits plan. As Greg said, we really, at the end of the morning, we want you to walk away with something or a number of things that are going to be of value to you in your workplace. And I think that more than just being a health symposium, this is a great workplace symposium as well. So it's not just personal health, but it's the culture of organizations that is going to drive your business and profits going forward in the future. Our first presenter is going to deal in that area, Donna McCandlish, and you're going to be introduced to a program called M.A.P, My Action Plan, which is a free, online, confidential assessment that you can, as employers can take back to your employees. That will be of value as an employer and for your employees at the end of the day. You're going to be introduced to that and get details. You're also going to be updated on the drug landscape. And we've done this now for the last 2 or 3 years. And you're going to, Brent Delvaux is going to provide that from TRG. And then after the break, you're going to hear about melanoma. And I'm not sure how much you folks know about melanoma, but I did not know very much until I had an interview with an oncologist. I did not know that melanoma is a condition of children. It starts in childhood. As a child, if you get a bad sunburn, you're 50% more likely to have melanoma as an adult. Women are generally diagnosed with melanoma in their 20s and 30s, men in 30s and 40s. 20 years ago, the incidence of melanoma was 1 in 250 people. Today, it's 1 in 60. In 2015, it's going to be 1 in 50. A lot of that has to do with lifestyle. Melanoma, if you know anything about it, it's a nasty cancer. All cancers are nasty, but this is a particularly nasty one. But the good news is that education, treatment, early treatment, is very, very successful. And you're going to hear from a passionate advocate and founder of the Save Your Skin Foundation about what they've done in moving this forward. And at the end of the morning, you're going to hear from 2 executives from organizations that have become great workplaces and have been recognized as great places to work. And I would ask, as you think about this morning, in your own workplaces, are you a great workplace? And if you are a great workplace, you may have some things that you want to share in our question and answer with the panel at the end of the morning. Are you moving toward becoming a great workplace and there's barriers? You may want to think about that and ask these folks that have been multiple award winners, what they've done in order to be a great workplace. Or you may simply want to ask, why would we want to be a great workplace? What's in it for us as the employer? So there's some questions to think about as we go through this morning and as we get to the panel at the end of our morning session.
It is great to be here. Thank you, Roy. Thank you, Lorraine, so much for making this opportunity available to us to come out and talk to you about mental health M.A.P. M.A.P standing for My Action Plan. It's great to be here. It's always wonderful to be in this beautiful city of Vancouver. And it's really opportune that I'm talking to you today about this particular initiative of ours, this, of course, being Mental Health Awareness Week. I'm going to give you a little bit of context for why and how and who developed this particular resource and tell you a little bit about the Mood Disorders Association of Ontario. We're a not-for-profit organization. We support individuals and families who have been impacted by depression, anxiety, and bipolar disorders, helping them to recover and heal. And we do this in a number of ways. through awareness building and education in schools and communities and very much in the workplace, through family and youth clinical support, and we probably help through counseling about upwards of 100 families and youth every year. We have a variety of recovery programs that we offer, and we have peer support groups through 34 affiliate members across the province of Ontario. We're a small team. There are 7 full-time and 3 part-time staff, but we are very generously supported by a cadre of over 170 volunteers. Most of our staff, or say many of our staff and most of our volunteers, are people who themselves have experienced these illnesses. So when our many constituents engage us, they are engaging with individuals who have effectively been there and who are knowledgeable, empathetic, and can convey wise insights and certainly messages of hope. We are also very fortunate to be able to leverage a lot of partnerships, some with the other community-based organizations, but also with various different organizations and corporations to help us, a small team, actually achieve big outcomes. And we'd like to think that what I'm here to talk to you today about is a big outcome. And you'll see, in fact, those organizations that got behind. We actually started crafting the plans for Mental Health MAP back in the spring of 2009 with the generous support of the partners you see here, AstraZeneca, Bristol-Myers Squibb, Lilly, Lundbeck, Pfizer, all being pharmaceutical companies, then the Ministry of Health Promotion and Sport in Ontario, Ontario Power Generation, and the Power Workers Union. Because of their generosity and their financial support, we were able actually to develop this new initiative as well. These folks have remained very active in helping us as part of our advisory committee. Mental Health MAP, I mentioned that MAP stands for My Action Plan, is designed to empower individuals affected by depression, anxiety, and bipolar disorders to recover and heal. It also allows their family members, should they so wish, to participate in that. It was inspired, designed, developed, and guided by individuals who have been there. So, as I mentioned, Karen Lieberman conceptualized MAP, wanting very strongly to be able to put a tool in place to reach as many people as broadly possible to help them to recover and heal. And what better place to do that than through the internet? Mental Health MAP takes a holistic approach to helping individuals take control of their recovery and continue on the road to wellness, borrowing from both the medical and the recovery models. As well, individual entries and plans are entirely confidential, while we as an organization have great access to aggregate data and can understand how people are using this tool. In fact, we do not have access to any private confidential information. An illustration that we've used a lot of video and a lot of faces and a lot of people to create that sense of interactivity. Here, for example, is Anthony Levitt, who is the Chief of Psychiatry at Sunnybrook Health Sciences Centre in Toronto, as he appears in the first lesson plan addressing the importance of planning.
Often a diagnosis of your condition will be very helpful. It'll help the medical professionals to understand what's going on with you, to project what treatment might help, and to project what's going to happen in the future. But the truth of the matter is that a diagnosis can be helpful. What's most helpful is to understand your particular issues, your particular needs, and what's going on in the context of your life. When we know that, we can plan treatment, we can look towards which kinds of treatment might help you best. But a diagnosis is a great place to start.
Most of the video clips are deliberately not too lengthy. This would be a shorter one, but they're all designed to be little sort of tidbits and sound bites that help people through the process as they go through the plan. You'll see here depicted Pam Miller, a personal trainer that has worked with us in delivering one of our recovery programs, that being Boost Your Mood, Eat, Move, and Be Healthy.
I remember a time when I wasn't feeling so great and someone asked me to join a gym. Oh, I was like, are you kidding? Where there's noise and tons of people and it's expensive. And I thought, what else can I do to start off and get off the couch? And one of the first things I did was figure out what it is, make a little plan on a piece of paper, what activities that I enjoy most. And one of them is, for example, tennis, and another is jogging. and walking. And so I chose those just to start off. So I started with the walks Monday, Wednesday, Friday, and slowly added in the tennis and the jogging. And one of the things that I also did was write down how I felt before I did that activity and how I felt after that activity. Often before, I felt tired, I felt a little down, I felt a little sluggish, not in the mood, but always, I can say 99% of the time, when I finished, I felt so good. I felt so happy, a sense of accomplishment. I just felt invigorated. So I really realized that on the times when I've had my own challenges, that this is one of the best medicines.
So apart from the lesson plans that I've described to you, there's an area on our website called My Journal Activity Trackers and Planning Reports. And this is where people can go to do exactly that, track their activities, provide journal entries. And you'll see here depicted, although again it's probably not easily visible on the screen, there's an actual scale. And the scale at one hand has feeling pretty low, and the other end feeling pretty high. And right in the middle is feeling really good, which is about where people want to be. So people can click on this scale on a routine-based daily basis, for instance, and actually track where they're at in terms of their mood at that particular time. In that same area, they can also make journal entries and track their medications, track their food, track their exercise, and track their appointments. Ultimately, being able to look back at their entries made and able to see correlations between some of those activities and where they tracked their mood. What you see here is what someone will see when they come back to the site having registered. And this basically is their own personal welcome page. So I would be coming back to the site and it's, hey, hello, Donna, acknowledging me and saying, this is where you were in your last activity. So it's actually showing you the last module you were working on. It provides a recommendation for the next module you want to work on. It is showing you some various different relevant social media announcements, or social media updates. So that is what you see when you come back to the site. Here, what you see is another section where people can go to the site to actually read about other people's journeys. So we've collected a number of personal stories from people who have worked with us over the years, who've benefited from MDAO programs, and who have shared both their insights as well as their messages of hope around recovery. So we hope to reach as broad an audience as possible through Mental Health MAP. We're currently involved in a campaign to profile it through very conventional and social media, community associations and partners. MAP can be used not only by the individuals who are taking advantage of it and charting their course to recovery, but as an educational tool by organizations interested in promoting mental health. And we would obviously be delighted to talk to anybody here. We think there's a huge application in workplaces to promote this as a tool that can be used by individuals. We are very happy to talk to anybody here about what that might look like. We've already been undertaking a little bit of work with some of the groups that have supported us in this project. So I'm going to close there and open it up for questions.
So thank you very much. You're with the Mood Disorders Association of Ontario. Is there a similar organization here in BC, and are you working with other groups across the country?
Yes, we are. And yes, there is. The Mood Disorders Association of British Columbia. Rennie Hoffman was the executive director there. He has retired, and I have not had the opportunity to connect with the current executive director, but there is an association here. My understanding is it has a fairly broad reach in BC. We try to collaborate with other organizations, not just mood disorders associations, but other community organizations such as, we've done a lot of work with the Canadian Mental Health Association. We worked on a project with them to create another web resource called Working Through It. That was supported by Great West Life, and it currently resides on the Great West Life Center for Mental Health, which if you haven't been there, you must go to. It's a fabulous site with a lot of great resources on it. So we try to, one of the things we've talked about doing, we don't have a French site yet, And in order to really have impact nationally, we need to have a French site for MAP. In fact, we've applied to the Bell Canada campaign. They have a campaign that we're hoping that they will award us some money to actually develop the French site, in which case we will work with the groups that are in Quebec to actually bring that to life and involve people from their areas. But we're always happy to partner with other groups.
Can you give us some examples of how workplaces have embraced the M.A.P. program, perhaps? I know it's very early in its
Right.
launch, but people here are probably interested in how they can use it in their workplace.
Right, absolutely. So it is early days. We actually, started testing the site. It took a while to get to actually the testing. Testing only started in June of last year. We then got to a lot of feedback, which enabled us to then make the kind of adjustments that we wanted to make. We actually piloted this with one of our sponsors within their workplace, Lilly Canada. So they were eager to take it and run it with their employees. We're just in the process. We've launched. We have promoted it. The Ontario Power Generation that I mentioned before is also piloting it at their Lambton plant as part of their mental health strategy. The Power Workers Union, as well as Ontario Power Generation, have promoted it to their employees, but they've also had us come in to do a lot of workplace education around mental health. So they're very much trying to promote awareness, get people to use the tools that are available to them. It's early days to be able to tell you specific results in terms of what that looks like. We are able to track the ongoing activity to the site and where people are going, the modules they're using, but we don't have specific, as I mentioned before, we're not tracking individual progress through the site. We're looking at aggregate data right now. One of the things we can do for organizations that may be interested in promoting this to their employees, we can create a splash page for your organization as a sort of a portal through which individuals can come to this site. And in doing so, we would be able to capture aggregate numbers in terms of the number of people who might be taking advantage of it. So it's early days, but that's the kind of thing. I think that combining this in a workplace with education around mental health, helping people to understand why it's important and encouraging them to make use of the tools available would be one thing that I would recommend to organizations who want to tackle the mental health issues in a workplace. You know, if you wanted us to come into your workplace to do some specific educational work and or create some customized portals for them to come through, there might be a small cost to your workplace, but it's not significant.
Currently, how would they access this webpage right now?
Okay, so what you have on I left some brochures on your tables. It's www.mymentalhealthmap.ca, and if you grab those brochures, you'll have all the information there about the site, and the URL is included there.
Donna, could you just say a little bit more about the coaches? Are they live coaches, or are they taped coaches, and how does that piece work?
I'm glad you asked that. I guess it probably wasn't clear. They are not live, they're pre-taped, but, and by the way, if somebody's, well into it and they're not interested in having their coach appear, they can turn the coach off. So that if they're coming back to the same module over and over again, they're not hearing this, "Hi Karen, you again." But the nice thing about the way we did this is when we were building this, we debated about should we get actors or should we get real people, authentic people. One of the things we learned in our focus groups was that they really liked the idea that this resource was, I'm going to use the phrase, being built by the people for the people. So there's a lot of authenticity there, that the people who are engaged and are involved in these are people who have, and I'm not referring to some of the experts, but certainly the coaches, are people who have lived that experience themselves. So and when we actually filmed them, they weren't scripted. They, being the coaches as well as the professionals, were filmed, and we would ask them questions, and as they answered the questions, we were capturing that. So they're not scripted, they're not actors. So what we hope and have been told comes through as a real sort of authenticity about what people hear when they're listening to them. And with funding, you know, we will be able to actually add coaches. We'd love to add coaches to reach more diverse groups than we're reaching today. As I mentioned, obviously, if we build the French site, we will be able to have French coaches. And we see an opportunity to look at other cultural interests and build in coaches from other diverse groups as well over time.